I'm joined today by Dr Marita Long, who's the Honorary Medical Advisor for Dementia Australia, University of Melbourne lecturer, and also a GP with a special interest in women's brain health. So, Marita, that's a long list of interests.
Yeah, I suppose I've been accumulating an interest starting out in general practice and seeing lots of women. So it's a natural progression, I guess, to go from women's health to now think about cognitive health.
And you're also a board member of the Australasian Menopause Society.
I am.
So we've worked together on that.
Yeah.
That's great. Now, we're actually talking about memory and cognition today. So I think most people understand what memory is, but how do you explain cognition really simply to people?
So if we think about the broader ranges of cognition, social cognition is a really important one. So that's someone's ability to socialise, to connect with people.
Right.
Attention is something that is really important. So being able to multitask or follow a story, a conversation, a movie, for example. Then we've got perception. So that's, I guess, putting things together in a sense. So what's coming in, what we're making sense of. And that can also involve doing things like being able to do tasks that we've been familiar doing. Language is another part of cognition, really important part of communication. So we can see some changes in people's fluency or ability to initiate or participate in a conversation. And then you've got learning. So that's the ability to take on, new information and learn new things. And then executive functioning. So that refers to sort of that higher order thinking, so judgment and planning. So you can see there's a broad range.
It's very broad. So it really is how the brain is working in your every day, right? So when you talk about brain health, as I've heard you talk about, you're really talking about that ability to keep cognition going and happening properly. Is that kind of it in a really sort of bad explanation?
No, that's exactly it. It's being able to keep your brain nice and healthy so you can participate in life, really. I think the important message is that for cognitive health, it's more than memory. So someone's memory might actually still be intact, but other areas of their cognition might be failing. So we have to think of it more broadly.
And that's really interesting because sometimes I think women, particularly at menopause, get worried because I miss a word every now and then, or like, where did I put my car keys? That is about cognition, right? So how do you know if it's something that's situational, I've got a lot going on at work or I'm stressed or something like that, versus normal aging? So I presume our cognitive function, like our physical abilities, decline as we get older. How do you know when something is not right?
And there's the sort of $1 million question, isn't it? So I think when we think about normal aging, and that does happen to everyone, that starts actually in our third decade of life, believe it or not.
30s, really?
So our memory starts to lapse a little bit, our processing speeds start to slow down, but our skills and knowledge and life experience allows us to keep up with those cool kids still.
Right.
But about 50, we do start to notice that things are changing, and that will be forgetting someone's name, for example, forgetting the name of that book you want to recommend for someone you just can't get. It's on the tip of your tongue, but you just can't get it out. Sometimes things becoming a little bit more difficult to manage. Things that you've been doing very easily might just become a little bit harder. You've got to pay a little bit more attention. I often think about doing a flat pack. So if, when
flat pack furniture?
Yeah. You know how challenging flat pack furniture is?
Yeah.
So it might be that you're doing that and you're finding it takes you a little bit longer and it's more difficult than it once was.
Okay.
So that's kind of normal, but you're still able to work and socialise. It's not impacting your ability to perform your duties at work or to maintain your social connectedness and your, I guess, enjoyment in life. You're not having to withdraw from things because it's becoming harder. So everyone goes through that. Some normal
men and women. It's not just this menopause thing that everyone talks about.
Yeah.
Okay.
So men and women. And it's a sort of a very slow change. There's nothing dramatic. You don't see dramatic changes. So that's normal.
Okay. So if we all get forgetful as we get older, asking for a friend, what are your top tips for remembering things?
Okay. So I think when we're thinking about normal aging, I think the first thing is that we do need to normalise it, that some of these changes are happening. You don't need to be fearful that that's a sign of something more serious. So it's really simple things, actually, like making sure you get good sleep.
Mm-hmm.
Yep. Making sure you're out exercising, keeping your
That's
body
important for brain health as well.
very important. The thing I love about exercise too is that it's often involves social connectedness, doing things
Sure.
outdoors with other people.
Really important as we get older.
Eating well. So your brain can't work well if you're not eating well. So it's going to be harder to remember if you're not eating well. And of course, not drinking too much. So you know that drinking has a big impact on people's brain function.
So all of the things that we kind of talk about for good physical health, good mental health, is also about good brain health.
Absolutely. Yeah.
So we've talked about sleep, getting sleep, nutrition, physical activity, not smoking, not drinking too much. Are there any other things that we can do for reducing our risk of dementia, these modifiable risk factors? What else is there?
So in fact, there's 14 modifiable risk factors.
That is way too many to remember, even if your cognition is super.
So I think we think about them basically in terms of vascular risk factors. So when I refer to that, I mean things like high blood pressure, high cholesterol and diabetes.
So they're the things that if you're going to see your GP about your annual health check, that's what they'll be checking for your heart. So that's a pretty automatic thing if you're going to have those annual health checks.
Yeah, we've just got to start
That's
thinking about
helpful.
them around the brain as well. And then we have other things like brain injury, so the importance of wearing helmets and seatbelts so that you can limit any brain injury. And then we've got things interesting like hearing and vision.
Hearing and vision are a bit surprising. Why do we need to worry about our hearing and vision as we get older?
So it's an interesting one, and it's partly to do with, could that be, I guess, a sign that there could be something going on neurologically, or is it because we have less input? So if we're not hearing well, we tend to not engage in conversation.
Sure.
We tend to not go out if it's a noisy place because it's difficult hearing. So that might then predispose you to being a bit more isolated, perhaps predispose you to getting depression. So hearing's really important, and it's the one thing people don't like doing anything about.
Oh, I think I might be guilty of that myself. Yes, going to see an audiologist and having your hearing checked can be expensive, but really important.
Really important. And then vision, the same thing. So if you're not seeing well, we're going to be less likely to feel confident to go out, walk around, perhaps go to
That's true.
movies,
Yes.
Again, engage in that social interaction, which is so important.
And if we're talking about using our brain and we're not reading because our vision is reduced, that's also going to be really tricky to exercise your brain.
Absolutely.
Okay, really interesting. And is it a case of just recognising the need to be a little bit more organised? You have those task lists, use your diary, just to not expect that you can just juggle it all mentally? Because I know myself, you get to midlife, it's got the child thing, you've got family things, you've got more work things, and I just wonder whether it's me forgetting things or it's also just there's just so much more to juggle now.
Yeah. And I think that's when you're younger, you could sort of keep in your mind what social events you had coming up and what the work deadlines were.
Right.
It was much easier. As you
Sure.
get older, it does get harder. And I think it is just owning that and saying, right, well, now I do have to start relying on that diary. We're lucky now we have electronic diaries. It's a lot easier, isn't it, than lugging around a big black book.
So if I can no longer expect to run 10K in a certain amount of time, I can no longer expect to remember everything I have to remember, because that's
a great way of
reassuring in some ways, really.
Yeah.
Now, the challenge, of course, is dementia. The rates of dementia are increasing, and in fact, it's now, correct me if I'm wrong, it's now the leading cause of death for Australian women.
Yep.
When do we need to start worrying about dementia, I guess, or what are some of the signs? What are some of the first signs you might notice if you have dementia?
Yeah. And I guess this is, again, the take-home message, just to remember it is more than memory. But memory is often the first thing people notice, or what's being noticed about people.
Right.
So, you just talked beautifully about the fact that using a diary is something that can be really helpful. So you're recognising you need to rely on a diary and you're using your diary. If someone had dementia, their memory would be changing, but they wouldn't have that, I suppose, metacognition to be using the diary
So they don't
effectively.
realise there's a problem along with the loss of memory. They're not
Potentially.
recognising there's a problem.
Or they may not have the ability to put those supports or those structures in
Okay.
place to remember that they've got a doctor's appointment or
Right.
to remember that they've got a bill coming up. So you'll start to see that there is some change in function.
Mm-hmm.
So you're making some errors or some omissions. And that's probably that sort of first sign. But we can see other things as well, like if we think about, I'm going to think about my dad, for example. He had dementia. So he used to love going out to Chinese restaurants.
Mm-hmm.
That was his
Right.
favourite restaurant from when we were kids. That was our treat. We'd go to a Chinese restaurant. All of a sudden, he didn't like going to Chinese restaurants and he would say, I don't like Chinese food.
Oh.
Yeah, so it was a very strange change in him because that was his love. And really what it was, he didn't feel comfortable anymore in a noisy environment,
Right.
in a place that was busy, where he might have struggled to remember the process of ordering, paying. So that was what was going on for him. So it's those changes that should pique people's curiosity to think this isn't normal behaviour.
Right. That's
Yeah.
really interesting. So it's, I guess, the one of the myths or the classic perception of dementia is, oh, suddenly someone's forgetting everything. But it sounds like it's a lot more than that.
Yeah.
It's not being able to have those conversations with people.
Yeah.
Yeah. Okay. Right.
So it might be that someone's picking up a book and they're reading a couple of pages and then all of a sudden they've lost in that book. Or it might be the person who used to love watching, series on television but would be asking a housemate or a partner, oh, what just happened? Or what are we up to? Oh, which episode are we watching? So
is it often the people around you who will notice some of these signs
Yeah.
before you'll notice them yourself?
Yeah. Yeah, that's often what we find. It's often we find in clinical situations, the people who are presenting, telling us they're worried they might have dementia, are often having more dementia worry or anxiety around it. It's often when someone else is bringing the patient in and saying, I've noticed that there's some changes with mum or
interesting.
dad or partner.
Very interesting. So in your work with Dementia Australia, what are some of the most surprising things that you've learned about brain health and ageing?
I suppose the first thing is really understanding that dementia is a collection of symptoms, not a disease.
Oh, I don't think I knew that.
And there's lots of different causes of dementia, but
I did know
dementia
that.
really refers to the symptoms.
Right.
So in Australia, we have Alzheimer's as a leading cause of dementia. So that was probably, I guess that's been one of the big things because we're not taught about it.
No, I did not know that
Yeah.
myself. How interesting.
So that's one take home. I guess the other thing is that although there's no curative treatments for dementia, working with Dementia Australia has really highlighted there is so much that we can do to help people who have been diagnosed with dementia and people who are worried about their risk for dementia. So there's a lot we can do to prevent dementia now.
Now, that's what I'm really interested in, that prevention. What are some of the things that people can do if they're really worried about dementia? What are some of the things they can do to reduce their risk?
So great question. And I guess we go back to basics. So we go back to smoking, nutrition, alcohol.
Not smoking.
Not smoking, not drinking too much. Having a healthy diet, and I don't know that we have to particularly be fussy about what diet, but just having a broad, healthy diet that includes all the food groups and keeping yourself physically active. So they're the basic things. Sounds easy, doesn't it?
Well, that's right. It does. But actually, they're often the harder things to
They
do, aren't they?
often
We'd love the pill that we could
It
just
would be
take.
lovely.
Now, tell me a little bit more about physical activity. It's, I think, one of the things we've learned from a lot of women that we've spoken to, Jean Hale's crew, is that physical activity is a phrase that we throw around a lot, but a lot of women don't actually know what that means. If we're thinking of a group of women who are 60 plus, say 65 plus, when we're talking about really good physical activity, what are we talking about for that age group?
I mean, really for me, my thing would be finding a physical activity you enjoy. That might be walking, that might be gardening, that might be going to Pilates, and doing it every day.
And ideally with someone, because social connection, am I right? That's also really important for dementia risk.
Absolutely. And the beauty of walking with someone else is you actually have to multitask. So you have to walk, you have to talk, So you have to be navigating a whole lot of things. So it's really good for your brain to be walking and talking. And walking's pretty easy. Doesn't cost much.
Right.
Pair of runners.
That's it.
Go around the block a few times, walk around the garden. So I don't think we need to get too caught up on you have to be doing this or that.
So it's not, 30 minutes of really high physical activity. It's just keeping active.
I think that if you went into all the breakdown of research and you'd get some people saying it should be, HIIT, some people are saying it should be strength. I just think if you can do anything that you enjoy, you're going to be more likely to do it. So it's going to be beneficial.
Now, my mother does crossword puzzles all the time, or Sudoku, to keep her brain healthy. Is there any truth to that?
Well, what we know is if you do a crossword every day or Sudoku every day, you get very good at doing crosswords and Sudoku. But it doesn't.
I can attest to this.
It doesn't necessarily improve or optimize your brain function. So what we know really is you need to challenge your brain. Just like with physical activity, you do need to challenge yourself. It does have to get a little bit harder. It's the same with your brain. So for someone who is in a very cognitive-based job, for example, like me, so sitting in an office and trying to diagnose and help people with their various medical conditions, I would be better to go and learn a language or a musical instrument or a new dance routine. So use another part of my brain to really stretch my brain.
Right.
Does that make sense?
No, it does. Absolutely. So it's a little bit like that, use your muscles or lose it. So some of the things out there there are lots of free language learning programs online, for example, that you could do, things like that.
Yeah, so something that's different, that's outside of your normal realm of cognitive activity is really important.
Fantastic. What do people do if they are worried about dementia? Where would you go for information, for help, for diagnosis? What's the next step?
I think that's a really good question to ask. And I think it's worth spending a little bit of time just to focus on dementia worry, because actually dementia is now the second most feared condition for Australians.
Oh, interesting. And that's because I guess so many more people have it. People are exposed to it, or?
I think that probably most people know someone now who's got dementia. We're seeing a lot more interest in dementia risk reduction. We're also seeing more famous people be diagnosed with dementia. We're seeing it more in the movies and even TV programs where the protagonist has dementia. So we're all becoming much more aware of it. And there's an incredible fear and stigma around dementia. And that's partly because I guess there's no known curative treatments. And there's been a really negative representation of people living with dementia in the past. And I think a lot of that comes down to just lack of understanding. And in fact, the World Alzheimer's Report just recently published highlighted that 80% of the general public think that dementia is part of normal aging.
And it's really not, is it? I mean, it is absolutely a disease or collection of symptoms caused by diseases. Yeah,
absolutely. And alarmingly, 65% of healthcare workers also think dementia is part of normal aging. So there's a real lack of understanding about what dementia is.
So let me demonstrate my own ignorance here, Marita. Why shouldn't I be scared of dementia?
I think having that fear or that worry in some ways can be a positive driver in terms of it might motivate people to pay attention now to how to protect the risk of developing dementia. We know that dementia, the symptoms present in later years, so after the age of 65 generally. Right. But we know the pathology starts now midlife. So having a little bit of worry is probably a healthy thing.
So when you say pathology, let me break that down. Pathology starts in midlife. That actually means those changes in the brain that then could lead to dementia if you don't perhaps do something about it.
Absolutely.
Start in midlife. Right. Okay.
Absolutely.
Just making sure I understand.
So a little bit of worry is a good thing because it might motivate people to go, right, I've got to take this seriously and I've got to do something about it, just like we do with our heart health and our bone health, all those other things. So the fear, I think, partly is lack of understanding. I think the fear is also being driven by there not being any available curative treatments. But the good news there is that we do know that there is a lot we can do to help slow down the progression of the disease, support people living with dementia with a better quality of life. But it really does rely on a timely diagnosis.
I see. Okay. So when you say curative treatments, that in layman's language, that means there's no cure for dementia. We can't stop it, reverse it, turn it around. But if we get a diagnosis soon enough, there are treatments available that slow it. Have I got that right?
Absolutely.
Okay. And so that timely diagnosis, where do we go for that timely diagnosis?
Yeah, so that's really important. So I think if anyone has any worry about their own or someone else's cognition, that contacting Dementia Australia is a really good first port of call. They have a 24-hour national helpline with trained health professionals who can listen to someone's story or concern and can guide them about where to go for that next step.
Oh, that's fantastic. Now, we also know on the basis of that too that women are more at risk of developing dementia. Do we know why?
I think that still remains the million-dollar question.
I think that's the second million-dollar question we've discussed.
Probably. I mean, women do live longer than men, a little bit longer than men, but that's really not enough to explain the increased number of cases. Look, it might be that if we're looking at the current older population and we think about roles of men and women, men were more likely to get access to a higher level of education. They're probably more likely to be in a cognitively stimulating job. And they probably also had things like their vascular risk factors more aggressively addressed. So we know that heart attacks happen in men. We don't think about it so much in women. So in some ways, men have had a chance to get a better cognitive reserve and a better brain reserve. So hence we're actually seeing a decrease in the number of men being diagnosed with dementia.
So as we start to get a little bit more serious about women's heart health and an understanding and recognition that women do have heart attacks and they do look different from men's heart attacks and we need to pay attention, we might actually start to see the number of cases of dementia go down.
Yeah, because we're modifying those vascular risk factors. Yeah.
It really does come back to those good, healthy life choices at every age. Yeah. Right.
And I guess the message there is that we have to think about it on every level. So for some people, the lifestyle factors or the choices can be really difficult. So it has to not just rest on the individual, it has to rest on the healthcare professional also, giving people the correct information. And also we have to turn to our governments to really support those better lifestyle choices.
Yeah, that's a whole other podcast, how we create an environment that's really helps us live very healthy lives. But I'll go back again. Dementia Australia are doing some fantastic work around their 24/7, or not, is it 24/7 call line?
Yep.
It is. That is extraordinary. Are they also doing health professional education? Like if I go to my regular GP, will she know the dementia risk factors, or is this a case of having to arm yourself with a little bit of knowledge before you head in to see the GP?
Yeah, I think like a lot of things, the poor old GP has to know a lot about a lot of conditions, and sometimes it may not be something that they're particularly au fait with, and that's why having a podcast and getting out to as many people as we can to let people know that there are things that you can do, that you can go along and see your GP about.
Yeah, great. And I certainly do not want to be bashing up GPs because they do have to be across a lot. All right, so if there was one thing you wanted all women to do to take care of their memory and brain health, I feel like one thing is going to not be enough. But if it was just one thing, what would that be, Dr. Marita Long?
Exercise.
Exercise would be the one thing. Great. That's that physical activity again.
I think so. And doing it in a group setting, I think, is a great way to do it as well because of that added benefit of social connection. Physical activity also improves your mental health. And we know that depression is a big risk factor for dementia. So if people are out socially engaged and, be it in the sunshine with a group of people, their mental health is also going to be better. So that would be my big take home.
Thank you very much for coming to talk with us, Dr. Marita Long, and I am now going to go and do some walking around the block.
Great.